Hi everyone, I'm Daksha Mystery. I'm the manager of Kingston and Richmond Safeguarding Children's Partnership, and I'm here with Cassie.
So I'm Cassie Spratt. I am the Associate Director of Family Help. We're here to talk about the Loving Care Child Neglect Toolkit.
Yeah, so we're really excited to let everyone know that this is now available for use online, and I thought we could just explain to people why we've created it in this format.
Yeah, so the Child Neglect Toolkit is not something that's new. It's been around for a while, but I think the usage of it was not nearly as high as we would like it to be, and it's such an important tool and it's so useful, it's such a visual thing that we decided to redevelop it, and we took so much input from lots of different partners and agencies, and of course our expert on child neglect, Jane Whiffen, and we have developed a new interactive tool that's based on technology and that's really visual and that can really help practitioners, and it should be much easier to use than the previous one.
Yeah, absolutely. And what we found from our recent reviews is that neglect is a key factor, and quite often we're not being able to evidence it in a tangible way. So I think using this toolkit is a really good way forward in terms of identifying neglect and thinking about strategies and interventions for children and families.
Absolutely.
Since launching it, we've got a range of questions from multi-agency practitioners, so I thought it would be quite helpful if I ask you the questions that come up most often.
Yeah.
Are you happy to kind of just go with it? Great, thanks Cassie. So the first question we hear quite a lot is, because the toolkit is currently on a platform which is part of the AFC website, people often ask us, when I upload information, who sees this? Because it's on the AFC platform, so I'm wondering about who will see the information about the family that I'm writing about.
So the only person that it gets sent to is yourself as the author, but we do have a spreadsheet that documents who has recorded it, and that's really for our purposes, so we can have some oversight of what partners are using it, what social workers are using it, and we can inform training. But other than myself and the team that created it, nobody else has access to that, and it wouldn't be looked at for anything specific.
So basically what you upload on there is confidential. It's only looked at in terms of usage rather than details of the family.
Yeah, absolutely. And I think what is important to know is that, it doesn't automatically get sent to the single point of access, doesn't automatically get sent to anybody except yourself. So if you want to use that tool yourself and then save it and then maybe do it again with a family, 6 months on, but not send it to anyone, that's absolutely fine. If you want to do it and then send it to the single point of access, or use it within, a school team around the child meeting or something similar, that's absolutely fine too.
That's really great to know. The other comment we get quite a lot is it is big. There's lots of questions on there. It's wide-ranging, and so people often ask, do I have to do all of it?
Absolutely not. And I think that is what's so great about this version, is that you just do the sections that are relevant to you, and when you do your oversight at the end, they're the only things that come up and show up. So it's really visual, and it just gives that snapshot of what you're interested in. So for example, we've recently sent it out in our MACE, so multi-agency child exploitation learning that we send out, because there's a specific section around adolescence that's really useful when thinking about child neglect. So you can just do that snapshot. Again, if you have a child going to A&E and somebody in A&E is worried about child neglect, then they can absolutely just fill out the health section and do that snapshot and send that through.
I think that's really important for practitioners to remember. You don't have to do the full thing. You can pick sections of it, or even just a few questions out of it.
Absolutely, and I think for the single point of access, say, they don't go out and meet families, but what I know that they do is they open up that tool and they look at different sections and they use that to inform the questions that they ask families.
Yeah, that's great. Another question we get is that, particularly from the multi-agency, is that I'm not a member of AFC. Can I access it despite not being part of AFC?
Yes, absolutely, and I think again that is why we have created it in partnership with the KRSDP, because it means that it's accessible to anyone, and it was made by the partnership. So you don't need to be within AFC to use it. In fact, we want people outside of AFC to use it more.
Absolutely. Any professional working across Kingston Richmond, please do use it. It's not specific to any agency. The only relevant thing is you want to be talking about neglect. So any concerns about neglect, please use it. Okay, the next question is around, can I print it and use it in that way?
Yes, so there's, as soon as you open up the toolkit, there is a PDF version, so you can print it and take it out. But again, we encourage you to either then copy that into the digital tool and use it that way, because it's the visual. So when you click certain things, it does give you color, and this was designed in mind to help parents really be able to understand where we're sitting in terms of worries, and so that they can see the progress. So if they do it once and there are a lot of reds, which would be the things that we were worried about, and then we do it again and there's no reds, that's an immediate visual for them to be able to understand that actually things are improving. So we want them to be able to do that. And again, if you're doing it, if you're writing it down and you're circling things, you might lose it, you might not upload it. You know, it's designed to be able to use on your phone, on a tablet, your laptop if you want to. So it's designed for any kind of digital device.
Yeah, so yes, if you really want to print it, you can. However, if you are printing it, please upload it in the digital version as well.
Yeah.
Okay. And then what about consent? Do I need the family's consent to complete this toolkit?
I mean, it is designed to do with the family, so you absolutely should be talking to them about it, explaining to them why you're using it, and you do need to make sure that they're okay with you using it. Like anything within safeguarding and the single point of access, if you're extremely worried and maybe you don't have that engagement from a family, but you know about worries to do with child neglect and you want to use that tool, then, you know, if safeguarding overrides that parental consent, then you absolutely can share that. But we always encourage you to share it with the family and let them know what you're doing. And it works best when you're using it with the family and letting them see that visual.
Yeah, absolutely. So what about if I, for example, completed it next week and then I wanted to go back in 6 months' time to see if there's been any change? Do I have to start again from the beginning?
No, so it has quite a good feature where you can say if it's an initial or a review, and then you can see the difference between the two. So, but again, you only need to do the sections that are relevant. So some sections might need updating and some might not. So you can put that within the toolkit.
And it's a great way of tracking change, isn't it?
Absolutely.
Can I use the toolkit with children?
Yeah, I mean, you can use anything with children, and again, I would say it's probably useful to think about questions or think about things that you want to ask them about, and then maybe go back and fill it out later. I think depending on the age, you might want to share it with them, and you might not. But I would say that's something to talk about with you know, other colleagues or managers to see if it's appropriate for a child to see it.
Yeah.
But parents really should be able to see it, be able to access it, and really understand it.
Okay, great. And can I use it as part of one-to-ones?
Yes, absolutely. So we really encourage you using it in joint supervision or supervision with your manager, or a one-to-one where you're thinking about risk. Because again, somebody from the outside might be able to, I guess, tell you your questions or notice things that you don't notice, especially because of that color visual. So absolutely use it as a way to think about if a family is improving or if we need to be more worried and do more.
Yeah, quite often when you're working with a family, it's hard to see things that are changing. So somebody else looking at what you found from the toolkit, I think would be a really good idea, wouldn't it?
Yeah, and I think as well, child neglect can be different for everyone, what that looks like, what people's own experiences are come into that when we're working with families. And so this toolkit is a way to try to take away some of that and just make it quite factual, because there are different categories and there's lots of different questions. So you should be able to evidence that child neglect regardless of what your own views on it are.
Yeah, because people often worry, don't they, about, is it just me? Do I think it's dirty? What do other people think? So trying to get that sort of tangible evidence is quite useful for us, isn't it?
And again, like another really great thing to do is, like, say you are working with a range of different partners and you ask the health visitor to do one, and you ask social care to do one, and then combine them and see what areas you think, and it's a really good discussion point to think about, actually, is this really a worry, or is this something that maybe is okay, and actually we're putting too much onus on that.
That's really interesting, because that was my next question that's come up. So can I share a completed toolkit with other multi-agency practitioners?
Yes, and I think, but again, it's just about informing the family and letting them know why you're doing it. I think if you're doing it as a way to really understand risk and to really help a family, then that's absolutely fine.
And also related, can I use the toolkit as a part of a referral to SPA?
Yes, I mean, that is hugely encouraged. So what we're trying to get the single point of access to do as well, if we have any referrals that come through in the category of child neglect or a similar category, if they haven't used the toolkit, we're asking them to write back and send the link and say, please use this toolkit in the future, so that we're getting more access to that.
And similarly, is it something you can use as part of assessments?
Absolutely. And again, you know, if you're in the professional network and your partner agency and social care haven't done the child neglect toolkit yet, or it hasn't been part of the plan, absolutely encourage that to happen, because we want it to be a tool that is used in helping to assess risk.
Okay. Something that I'm very aware of, and I see a lot in reviews, is practitioners talking about parents loving their children. And I'm wondering how we can use this toolkit to help people understand what love looks like. What does it mean when parents, carers say they love their children? What does it actually mean to them? But also, what do children need to feel loved? And what's the experience for them, particularly when they're living in a neglectful household? Do they feel loved? How can we get practitioners to think a bit more about that?
Yeah, and I think that's something that we see all the time, this notion that, you know, the house was really untidy, but we could see that the parents love their children. And I suppose naming it the Love and Care Child Neglect Toolkit is honouring that relationship between a parent and child, but also making sure that we're being evidence-based when we're recording what is happening in that house, because nobody is doubting that a parent loves their child, but risk and worry and concerns about child neglect, if they're there, that has to trump. You know, the welfare of the child has to be paramount.
And we have to think about the long-term impact of neglect.
Absolutely.
We need to think about that drip effect, and how do we address that with the family, and is it enough to say the parents love the child when we're thinking about harm and risk to the child?
Absolutely, Dasha. And I think in any review that we've done to do with child neglect, I think people feel a certain kind of emotive response, because it feels horrible to tell a family that we're worried about child neglect. It brings out things in practitioners, and they don't want to say it. And again, this tool should help you be able to just evidence why you're worried, rather than just saying, well, we're worried that the children are neglected. This is why, these are the concrete reasons why. And again, with the colours, you can see these are the areas that are of significant concern.
And again, if we see that pattern of things changing for a while and then falling back, we can actually evidence it and say, look, when we were doing this, or when you were doing this, things got better. And then that happened and it deteriorated again. So really being able to kind of drill down into those things to help people understand exactly what the concerns are.
Absolutely, and in Achieving for Children, we work on a strength-based model. We use signs of safety, and part of that is building on and enhancing things that are going well. So exactly that, identifying all of those areas that are going right, all those periods of time where things were going right, and then enhancing on that and trying to build on that.
Okay, that's the end of my questions. Thank you for your time, Cassie.
No worries, thank you so much.